Global Health Series number 47 is still discussing life expectancy, and the emphasis I've told you is on health prevention. Once people are able to work on their health, then what we are doing in global health would have been achieved. And today we want to discuss Denmark and Niger Republic. I know some people call it Niger Republic, it's Niger, and then Denmark. We want to talk about the social determinants of health. The life expectancy in Denmark is 80 years. The life expectancy in Niger Republic is 59 years. So there is this disparity of almost 21 years. What do we do with that? If somebody in Denmark is born the same day with somebody in Niger Republic, one dies at an average of 80 years, the other one dies at an average of 59 years. There is a problem. And that comes under social determinants of health. We want to talk about genetic factors, things like sex, things like age. When people are born in Denmark, indeed before the children are born, the mothers are well catered for, they are well provided for. The kind of medical attention, the healthcare delivery system is almost perfect when you compare it to what happens in Niger Republic. And as a result, you see there is a problem of people growing up in Niger as normal people compared to those in Denmark. Genetic factors, as a result, has to play some role in what happens in different countries. And these are things policymakers ought to take note of. Even in Niger Republic, that mothers are supposed to be catered for. There should be something like prenatal care. There should be something like providing for the unborn children and even the children who are born, so that as they start developing, they live better. Then apart from genetic factors, you also have the behavior within the environment. The environmental behavior of the people is very, very important. People that consume a lot of alcohol, people that indulge in drugs, people that indulge in smoking a lot will always die faster, either because of what they are doing. A lot of people are killed by alcohol when it is too much, and when you have high consumption, it's always within the poverty-ridden areas. And that's what happens in Niger Republic. They take that as part of their leisure, consuming a lot of alcohol, being able to smoke so massively. And when you compare that to what happens in Denmark, you see a very massive difference. That is what we should take note of. Then there is the social environment where people live and they're able to affect each other, like the gender, like the income, like discrimination. Discrimination come under the social environment, how people are discriminated against in terms of job, in terms of how they are developing, how they are living, how the different genders. I remember a lot of people who go to school within the males, within such areas as Niger, and the women are not even trained, a pack of illiterates. The disparity in income within the poverty-ridden sections of a country like Niger will always affect the number of years they spend here on earth. So the social environment is a factor and has to be taken note of. Apart from social environment, you have also the physical environment. The crowded conditions in places like Niger will not allow people to live very long. So when places are crowded, towns are so messy, people are not developing and catering for their places, and those places are not neat, then it means the physical environment is affected. What of roads? What of bridges? What of places that they have to pass through? Where the physical environment is bad, then you expect that you have a bad environment, and that will affect how a country survives. Access to healthcare is another factor. The healthcare delivery system in Denmark, Norway, Sweden, all those places are better when you compare them to what happens in Niger, in Chad, in Ghana, in Sierra Leone, and some of these other West African countries. So that access to healthcare is very important. You don't have adequate access to healthcare in the Niger Republic, and as a result, even when people are taken to hospitals, I'm told they are meant to deposit money before they are even treated. And what kind of environment is that? When people are supposed to pay before they start treatment, it means when people are taken into the emergencies, they die right there when they cannot pay the money. And that is not what is supposed to be happening in a country that has so much money. So Niger Republic has to have a second look at that, the healthcare delivery system. How is it worth the problem? They should look at the equity, being able to distribute health in such a way that everyone will enjoy it. It happens in Denmark. It does not happen in Norway. I mean, in Niger Republic. They have to look at health inequality, where people are discriminated against according to their income, according to where they come from. That kind of health inequality is detrimental to the survival of an average person in Niger Republic. You also have to look at the health inequity, which is something that could be remedied just because some people are affluent than the others. These people are catered for and the others are not treated. So the poor ones, the ones that cannot help themselves, the people who are like beggars, the people who are looking for food, poverty all over the place, cannot have healthcare treatment. They can't even help themselves. So inequity could be avoided, but people just decide not to in order to maintain that gap between the rich and the poor, so that those that are wealthy are healthier than those that are poor. Then you also have, of course, health disparity between the different groups, different tribes, different enclaves, and the rest of them. That is not good for a country like Niger Republic. And then health literacy. How many people can stand up in Niger and tell you exactly what they want in terms of medical terminology, in terms of what is happening under the healthcare delivery system? People in Denmark are more knowledgeable when it comes to health literacy. They can read their drugs, they can interpret their drugs, they can tell you the quantities that are written by pharmaceutical companies. They can tell you a lot of things that has to do with the habits of the people in Denmark, which is not possible within the country of Niger Republic. And as a result, people die out of overdose. People die out of little mistakes because the health literacy there is so poor. Those are factors countries need to look into from time to time to see why people in some of these countries are doing better than other countries. When we list out factors like health literacy, or factors like health disparity, or things like access to healthcare delivery, we are saying that countries that are not doing that should look at these factors and be able to remedy them. The physical environment is very important, even in Niger Republic, where places are well made, where the environment is well kept, where there are no crowded conditions, people tend to live better. Then the social environment is also important. They look at the gender, the discrimination, the income coming into the households, and when they're able to take care of it, then people will live better. High consumption of alcohol, I've mentioned, will always allow people to die earlier, as it happens in Niger, and that could be avoided. So the kind of behavior, the social behavior, the environmental behavior, genetic factors are things we ought to look at when we are assessing why some people live longer than others. That's what we have for today. We are still going to continue from there with number 48 under the global health system. Thank you.